Good afternoon, everyone. It's Wednesday, May 13th, and I want to welcome you back to our 2:30 daily update public briefing. I'd like to begin today with our daily medical update by Dr. Ezike. Doctor?
Everyone, I want to begin by acknowledging all the hard work being done by the local public health departments and all of their dedicated staff there. These are people who work every day to make sure that all of our food is safe whenever we go out to eat, who investigate pertussis outbreaks or measles outbreaks. They help in certain situations to provide vaccines to protect children from dozens of preventable illnesses and so many things. Local public health officials are working to keep us safe and are making decisions based on science. They're using studies from national and international health organizations and using the lessons learned from around the country and throughout the world to deal with this virus. As we continue to fight this pandemic, it has become so clear that there are no clear black or white answers. Everything is in shades of gray, and public health officials are working tirelessly to navigate this novel virus while balancing what needs to be done to keep people healthy. And keeping in mind the very real consequences and the real sacrifices that people are suffering through as we endure this virus. Public health officials and the local health departments that they serve and lead are not the enemy. Let's remember that the virus is. So please understand the pressure that these dedicated workers are under. And with that, let me move on to the statistics from the last 24 hours. Today, we are reporting 1,677 new cases of COVID for a total of 84,698 total individuals with COVID-19 here in the state of Illinois. Unfortunately, our death total is at 3,792, of which 192 were reported in the last 24 hours. This is the largest one-day increase that we have reported thus far. Our testing capacity is increasing statewide, and we encourage healthcare workers, first responders, correctional employees, people with chronic illness, and those who are critical infrastructure employees, such as grocery store workers, truck drivers, and anyone who works for an essential business to get tested. In addition to the over 250 testing locations across the state, there are also 7 community-based testing sites, including the most recent one that opened in East St. Louis, where all individuals can be tested for free. Testing is one of the keys to reopening the state safely so that we avoid a potential second wave. To date, 489,359 tests have been performed. 17,668 were reported in just the last 24 hours. With the increase of testing around Illinois, for sure, there are an increase in positive COVID-19 cases detected. That is expected. But rather focusing on the large numbers of cases yesterday, one should take into account the very large amount of specimens that were resulted. And that is the win, that we are making more tests available to all people throughout the state, and we will continue to ramp up that testing capacity. The positivity rate statewide thus far is 17%. That means that for today, again, that was calculated on a 7-day rolling average. But that means for today, we looked at the number of positive and total tests reported from May 3rd to May 10th, because there is a 3-day lag. As of last night, 4,563 people were reported to be in the hospital with COVID-19 illness. Of those, 1,208 patients were in the ICU and 714 patients were on ventilators. Of course, we know that the numbers of the people in the hospital, the numbers of people that have passed on, they're not just numbers and statistics. These are real people, and there are families and loved ones who are suffering with each of them, whether in their illness or in their unfortunate passing. We together as a state mourn for all the lives that are lost, and we pray for everyone's quick recovery. You may not know someone personally who was sick with COVID-19. You may not know someone personally who has passed on from COVID-19. But please know that people of all ages are falling victim to this new virus. This is a real disease. This is a serious disease. It's not a hoax, and people need to take it very seriously. Please continue to stay home. Please maintain physical separation or social distancing. Please wear your mask. Please help us decrease the spread of this virus, and please help us save lives. Thank you so much for your attention. And with that, I will summarize comments in Spanish. Buenas tardes. Quiero comenzar reconociendo todo el trabajo que hacen los departamentos de salud públicas y sus trabajadores dedicados. Estas son las personas que trabajan todos los días para asegurar de que su comida sea segura cuando come en un restaurante, que investiga los brotes de tosferina y sarampión, dan vacunas para proteger a los niños de más de una docena de enfermedades prevenibles y mucho más. Los oficiales locales de salud están trabajando día y noche para mantener todos a salvo y están tomando decisiones basadas en la ciencia. Nosotros no somos el enemigo, el virus es el enemigo. Les pido que entiendan la presión que se encuentran estos trabajadores dedicados. Estamos trabajando para el estado de Illinois. Y con eso presentó el reporte médico de hoy. Hoy estamos reportando 1,677 casos nuevos de ayer para un total de más de 84,000 casos de COVID-19 aquí en Illinois. Hay un total de 3,792 muertes. 192 de ellos fueron reportadas en las últimas 24 horas. Desafortunadamente, este es el número de muertes más reportados en un solo día. Nuestra capacidad de prueba está creciendo en todo el estado y urgimos a los trabajadores médicos, policía, bomberos, empleados correccionales que hagan la prueba. También las personas con enfermedades crónicas y los que son empleados críticos como trabajadores de supermercados, conductores de camiones y cualquier persona que trabaja para un negocio esencial. Deben hacerse la prueba también. Hay más de 250 lugares de prueba en Illinois. Hay 7 sitios de prueba basados en la comunidad en todo el estado, incluyendo el más reciente que abrió en East St. Louis, donde esas personas pueden hacerse la prueba completamente gratis. La prueba es una de las claves para volver a abrir el estado de forma segura para evitar una segunda ola del virus. 17,668 pruebas fueron reportadas en las últimas 24 horas. Con el aumento de las pruebas en Illinois, hay un aumento en los casos positivos de COVID-19. Nosotros esperábamos eso, pero en lugar de centrarse en la gran cantidad de casos de ayer, uno debe tener en cuenta la gran cantidad de muestras que también se analizaron. El número de positividad en todo el estado es 17%. Desde anoche se informó que 4,563 personas estaban en el hospital con COVID-19. De ellos, 1,208 pacientes estaban en la unidad de cuidados intensivos y 714 pacientes en ventiladores. Una de las duras realidades de los ventiladores es que más personas morirán después de ser puestas en un ventilador de las que podrán salir. Es una enfermedad muy difícil. Estos no son solo números, son personas. Hay familias que sufren por su pérdida. Es posible que usted no conozca personalmente a alguien que estaba enfermo con el COVID-19. pero personas de todas las edades están siendo víctimas de este nuevo virus. Esta es una enfermedad grave y las personas deben tomarlo en serio. Por favor, quédense en casa. Usa sus máscaras. Mantenga su distanciamiento social. No contribuya a la transmisión del virus y no pongan en riesgo la vida de otros. Muchísimas gracias por su atención. And with that, I'll turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. Today, I want to update all of you on our work to support and protect the employees and residents of long-term care facilities around the state. This is our third recent update dedicated to this very topic, which we last covered 2 weeks ago on April 29th, as well as on April 20th. As you know, we have been focused on these facilities from very early in this crisis. Back in early March, long before we ever had a known congregate care case. As soon as we knew of COVID-19's adverse effects on elderly congregate communities, we implemented restrictions around visitors at facilities that we control, such as our veterans' homes, and worked with the state's vast network of long-term care facilities and their governing organizations to issue guidelines to implement similarly strict restrictions and protocols. Since then, as we've expanded our testing in Illinois, we've worked to prioritize testing at our long-term care facilities. As I announced on April 20th, IDPH is providing testing of all residents and all staff at facilities without known COVID-19 outbreaks, allowing us to potentially identify early the presence of COVID-19 in a facility and to isolate those cases before widespread transmission. IDPH is also providing tests for all employees at facilities with known cases, potentially determining who might be infected, but asymptomatic, and instead of working, should be in isolation. And of course, as with all healthcare workers, staff at these facilities have had some of the longest standing access to testing in Illinois. IDPH has prioritized testing at long-term care facilities home to our vulnerable populations where a COVID infection is more likely to lead to higher severity cases, especially among communities of color. Since expanding our testing, we've provided 30,000 tests to 129 facilities around the state. In addition to the IDPH-driven testing efforts, the contractual partnership that I previously announced with Quest Diagnostics has been making deliveries to long-term care facilities since May 5th. Quest and IDPH are working to scale up those deliveries and maintain a 48-hour turnaround for results as dictated by the agreement. I also want to touch on PPE distributions to long-term care facilities across Illinois. Long-term care facilities join hospitals and other healthcare facilities in being some of the many thousands of entities that the state is supporting through PPE deliveries throughout this pandemic. Local health departments are the first line of communication and support for all of these facilities. The state has delivered PPE to all 102 counties and continues to do so, including local emergency management agencies, regional healthcare coalitions, and local health departments. Again, we rely upon local public health departments to deliver to each individual long-term care facilities needed. Our state stockpile always provides a backup for them and is not the primary supplier for private businesses such as nursing homes. Having state government fulfill each individual request would not be efficient or in any way manageable. That said, these are some of our most vulnerable Illinoisans. And in this crisis, the state is doing everything in its power to protect them. So to assure that all facilities have their own stockpiles, IEMA and IDPH have coordinated a somewhat unprecedented effort to directly deliver PPE to more than 1,200 nursing homes and other long-term care facilities across the state. These shipments began on April 30th and have reached more than 85% of these facilities, with the final deliveries expected in the coming days. Each shipment contains PPE for managing 200 residents, and facilities with more than 200 beds will receive 2 shipments. These shipments include KN95 and N95 masks, surgical masks, gloves, face shields, hand sanitizer, and shoe covers. I want to remind nursing home facilities and their associations that to maximize the use of PPE, we've made available to them our new N95 mask decontamination system to stretch their PPE stocks further. This is a fully free service door to door. FedEx is handling the transport of masks from facilities to the decontamination site and back again. And the U.S. Department of Health and Human Services is covering all of the costs of using that system. Masks can be decontaminated up to 20 times without experiencing any reduction in performance. Facilities can contact IEMA to schedule pickup. The vast majority of Illinois' long-term care facilities are private entities, but our four veterans homes are state operated. So I also want to take this moment to walk through what these efforts have looked like at our facilities: Quincy, LaSalle, Manteno, and Anna Veterans Home. On March 5th, these 4 facilities were required to begin screening all employees and all visitors before entry into the homes. By March 10th, still days before our first known case at a long-term care facility, that directive was elevated to stop all vendors from entering the facility, put an end to all off-campus resident activities beyond critical medical appointments, restrict all family visits except for end-of-life events, end all construction projects at facilities, and modify dining protocols, including implementing in-room meals wherever possible. These restrictions have evolved contemporaneously with IDPH and CDC guidance, including the masking of all employees at facilities and the expansion of employee screenings to 3 times per shift, including the logging of temperatures at the beginning, middle, and end of a work period. As of yesterday, all of our residents and employees at our state's 4 veterans homes have been tested for COVID-19, and the status of each home I'm about to share is as of this morning. One of the 153 residents at LaSalle was found to be positive earlier in May. Subsequent testing revealed no additional positive residents and no positive results among 219 staff members. At Anna, full facility testing revealed 5 positive residents among 51, with all results back as of yesterday. And as of yesterday, none of the 78 staff were found to be positive, though a handful are still awaiting results. At Manteno, 30 residents of 220 and 19 employees out of 307 were found to be positive at various periods of testing between April and May. All residents were tested over the last few days. All positive residents and all residents they had direct contact with have been isolated. At Quincy, there are no known positive residents or staff to date. As of this morning, 50 residents and 250 staff tests have come back negative. 289 residents, as well as more than 50 staff, were still awaiting their results from DPH. Additional testing of about 300 staff and contractors is ongoing. I'm also saddened to share that a Manteno Veterans Home resident who had been in hospice care for several months for other conditions recently tested positive and has passed away. To the family members and loved ones of this hero, a person who served and sacrificed for the America that we all cherish, God bless you. My thoughts and prayers are with you. In this global battle for public health, the heroism of our veterans is more salient than ever. May we forever share their faith that the people, places, and values here at home are worth fighting for. The staff at all of our veterans' homes continue to operate with extreme vigilance in ensuring the safety of our nation's heroes through this crisis, adhering to best recommended protocols and isolation practices as determined by IDPH and other public health experts. It is these same guiding principles that my team and I encourage and expect of the private long-term care facilities that exist to serve seniors across the state. And it is in accordance with those principles that we will pursue any bad actors to the fullest extent of the law. I want to remind everyone that anyone, from an employee to a resident to an outside family member, can file a complaint with IDPH about an issue at a long-term care facility in Illinois, COVID-19 related or otherwise. And to the many thousands of healthcare workers and caretakers who spend their days caring for Illinoisans in these facilities, our veterans, our grandparents, our elderly neighbors and loved ones, thank you for all that you do to serve the people of this state and especially those elderly loved ones. Before I take questions from the press, I want to briefly address some of what we've been hearing lately from those who believe that we need to reopen faster than the science and the data dictates. Folks, I know this is hard. I know that people are hurting. This virus has taken many lives and destroyed many livelihoods. COVID-19 has turned our world upside down and stolen our sense of normalcy and stability. I want this to end just as much as you do. If I could take away the pain and the loss that you're feeling right now, I would do it in a heartbeat. But this virus is still among us. This pandemic is not over. And to pretend otherwise in a misguided attempt to reclaim what we've lost will only make this last longer. For leaders, there are no easy decisions in a pandemic. Every choice has consequences. And I know leaders across the state are struggling with these choices. And I have sympathy for them in that struggle. But what I don't have sympathy for is those so intent on disregarding science and logic, so afraid to tell their constituents what they may not want to hear, that they put more people's lives at risk. Here's what I want to say to those leaders. You weren't elected to do what's easy. You were elected to do what's right. To the small minority of businesses that choose to ignore the medical doctors and the data and to ignore your legal obligations to the residents of your communities, there will be consequences. Businesses and individual professionals that are licensed by state agencies will be held accountable for breaching public health orders. Counties that try to reopen in defiance may not be reimbursed by FEMA for damages they cause because they ignored the law. Local law enforcement and the Illinois State Police can and will take action. But there is no consequence the state could impose that is greater than the harm that you will do to your own communities. 192 Illinoisans lost their lives to this virus in the past 24 hours. 192. How is that not real to you? More people will get sick, get admitted to the hospital, and die if we don't stay the course and follow the guidance the experts have provided. To the elected officials out there who are playing to the crowd that ignores science and carries symbols of hate, step up and lead. Now more than ever, your communities need you. Don't let them down. One last thing before I take questions. I want to address something that I said yesterday regarding baseball and baseball players. I want to apologize for leaving the impression that baseball players shouldn't have the right to bargain to protect their health and safety. I absolutely support that right, and I should have made that more clear. Thank you, and now I'd be happy to take any questions from members of the press.
Eric from ABC7, we'll start with you.
Hi, Governor. Good Wednesday to you and to Dr. Ezike. Downstate Madison County and Adams County have both authorized their own reopenings. You sort of referenced that this just now, but other than withholding federal funds, what other enforcement mechanisms are you considering, and have you ruled out sending in state police?
Well, not just federal funds that we're talking about. As I just said, the businesses that ignore the executive orders, that ignore the law, will be held accountable by our Department of Professional Regulation, and will be held accountable by any licensing body, Liquor Commission, Liquor Control Commission, and others. So there are enforcement mechanisms here that we will be using against them. And I would again implore the leaders of these communities not to give in to the minority of residents who are clamoring to ignore the science and the data, but instead to follow the rules, to follow the law, and most importantly, to keep the residents of your communities safe.
Yeah, Greg Bishop from the Center Square has sort of a follow-up to that statement. What additional damage, though, would be done to local communities already reeling from the economic downturn if federal funds are withheld by your administration, if regulation gets involved and takes away some of the licenses of these business owners? I mean, these are folks that are already hurting. Who bears responsibility if their hardship gets even worse?
Well, they're the ones who bear the responsibility because they're the ones who are not following the rules. Let's be clear. What we're trying to do here is keep people healthy and safe and to reopen the economy simultaneously. And that's what the Restore Illinois plan does. Indeed, I would suggest to everybody that they take a look again at that plan, that it is more expeditious in many ways than the plan put out by the White House. But it also takes into account making sure that our healthcare institutions have the capacity to manage the people who will get sick as things reopen in the economy. If you do it too fast, what you're going to see is an overrunning of the healthcare system, and very importantly, many people getting sick, going into the hospital, ending up in ICU beds and dying.
My ABC7 colleague, Craig Wall, he asks, would you consider, Governor, getting out of Chicago and visiting some of these small mom and pop shops and restaurants in the suburbs or downstate to see for yourself how they say that they can safely reopen with social distancing, just like essential stores are operating currently?
Well, as you know, I've traveled quite a lot around the state, and I, of course, talked to business owners everywhere in the state and have been doing so especially over the last 2 months as we've been trying to provide supports for them and to make sure that we're putting rules in place for phase 3 and phase 4 that will make sense for them when it is safe to open. So I love to travel the state, love to go into communities. At this point, though, remember that for me to go in, to shake hands with people, to hug people the way that I like to do, isn't going to be a smart thing for them or for me, and it breaks the rules, frankly. Meanwhile, as you know, I've been very much in communication with the state of Illinois and speaking with the mayors, city council people, representatives from all over the state. And I look forward to a moment when we have a real opportunity to get together to celebrate the reopenings of businesses and the reopening of our economy when it is safe and healthy for people to do so.
Well, Governor, would you not benefit, from a firsthand view today of these locations, with their measures set up, with the plexiglass perhaps in some of these locations set up? Obviously you're sitting in meetings with scientists discussing models, but would it benefit you to go to some of these locations and eyeball yourself their current setup?
100%. And I would suggest to the business owners who are thinking about reopening against the rules, breaking the law, that they come to Chicago and come to a hospital in Chicago, or go to a hospital near them that has COVID-19 patients and talk to the nurses and the doctors who are on the front lines and ask them what it means to them that people follow the stay-at-home rules. Because the fact is that right now, what's so important is that people do the right thing for their neighbors, their friends, their communities, for everybody in the state. Frankly, most people are doing the right thing. And most people understand why we have a stay-at-home rule. It is a minority of folks who are breaking the rules and putting people in danger.
Marianne Ahern from NBC5 asks, based on the IDPH data that every region according to that data, every region except the Northeast is already green for phase 3. Why are they not reopening now? Why do they have to wait until May 29th?
Well, there's a reason why we're watching all of these regions over a period of time. First of all, if you look very closely at the data, things are not declining. The numbers that you want to have declining are not. There is a flattening of the curve, but not a decline. And so what we want to do is watch as we reopened. Remember, there were many changes that were made in the stay-at-home order on May 1st. And so once you make those changes, what you want to do is watch and see whether there is an increase in the caseload, in the positivity rate, in the hospitalizations, and so on. The same thing will happen when we enter phase 3. Once you enter phase 3, which is coming in 16 days, I believe, we're going to wait and watch because, people don't get sick immediately. What happens is they get sick, they get exposed, and then they get sick over time, and then they end up in a hospital, some number of them, and then in an ICU bed and so on. And that happens over the course of several weeks. So it's very important that we watch and carefully monitor what's happening in each region. But I am very glad that 3 of the 4 regions already look like they're on a path to reach phase 3. And I'm hopeful that the last region, the Northeast region, will also be able to reach phase 3 quickly. Although I would point out that there's a 14-day measurement of that last metric, that positivity rate, a 14-day metric for making sure that that's under 20. And it looks very much as if the Northeast region is heading that direction. And as I said, there are about 16 days left in the month of May. And if you average out looking at the last few days positivity and what likely will be a either stable or downward movement of that positivity number, the Northeast region will hit the mark by the end of May as well.
Dana Kozlov from CBS 2 wants to get your thoughts on the legislature getting together next week. And specifically, some Republican lawmakers are preparing or have already prepared legislation allowing for other businesses to reopen and requiring you to get legislative approval on any additional emergency declarations. Your thoughts?
It's their right to introduce legislation. I mean, I think everybody understands that what I've been doing is following the science and the data, doing what's best for our economy, given that the virus is out there. I want to remind everybody that when people get sick and when they die, that too has an economic cost. I mean, aside from the terrible cost to families and communities, there's also an economic cost to our state when that's happening. So take that into account when you're suggesting that we should follow a different path.
Governor, I got to ask you if you have an update on your staffer who tested positive the other day. Is that person still asymptomatic or now showing symptoms? Has any other staff member tested positive or showing symptoms?
No other staff people have tested positive to my knowledge at this point. And the one staffer who did, I was in contact with today, and that person indicated that they are feeling fine.
Have you been tested again since Sunday?
I have not.
Should you be tested every day?
No, I have been isolating. There's no reason for me to test every day. I think, once we discovered that someone was positive in our office, I think it was appropriate for me to get tested. And, at this point, I'm simply isolating like others do when they find out they've been in somewhat close contact with someone who's tested positive.
Pam Zekman from CBS 2 asks, we continue to get complaints from people who cannot collect unemployment benefits because of a variety of mistakes that the system can't seem to correct unless you call certain numbers, and at those certain numbers, no one answers. What are you doing about this, and why is it taking so long?
Again, we have many thousands of calls that come in each day. Thousands get answered and responded to, and people get processed over the phone as well. I realize that it is difficult when you can't file, if there's some problem with your filing online, and it requires perhaps an arbitration or it requires some other intervention, that it does mean that you'll have to have a personal discussion with somebody. We're working very hard. We've just spun up this outside call center to add on top of the internal IDES capability, and we're getting to them as fast as possible. Again, with an unprecedented number of filings, it is difficult. But I will say that the new PUA system for people who are independent contractors who are filing is resulting in tens of thousands of people being able to connect with the system. And as I indicated yesterday, about 50,000 filings.
My ABC7 colleague Ravi Baichwal asks, you have scaled up testing or mandated the scaling up of testing at private nursing homes, and in your comments today indicated that effort continues, but are there further testing measures that can and should be implemented at those facilities, perhaps on par with what's happening at the state-run veterans homes?
Well, we are, in fact, doing that. We've actually, for several weeks now, we've been hard at making sure we get to every nursing home to do the testing that we'd like to do. That includes not only the testing of people in facilities who, where there is a COVID positive outbreak, but also in facilities where there aren't any COVID positives. We want to make sure that we're sort of monitoring our nursing homes quite closely. The White House just the other day suggested that all the states do what Illinois has been doing for some time now.
Elizabeth Matthews from Fox 32, also a question about nursing homes. We are hearing from nursing home owners who are saying that testing supplies are still scarce. When can nursing homes expect more testing supplies or PPE? Is there a shortage of COVID-19 tests for those long-term care facilities?
Well, there's a shortage of tests all across the country. We've prioritized those nursing homes, so they're actually getting many more on balance than other facilities or other locations are. And so to the extent that there's a facility that hasn't had testing, it's simply because there are so many in the state of Illinois. We now have, I think we have more long-term care facilities and deliver tests and pick up tests once they're completed. So our testing capability is spinning up all over the state. Nursing homes are among the highest priority.
Okay, I've got four more questions here. Amy Jacobson from WIND asks, the Illinois Attorney General has a written legal opinion that dates back to 2001 that essentially said that you are acting illegally. You did not have the power to issue the stay-at-home order beyond the initial 30 days, according to this legal opinion. Do you agree with the AG's office? If so, will you rescind the order as invalid? And if not, why do you believe you can disregard the AG's office?
Well, the Attorney General's office has not issued that to us. And indeed, the Attorney General's office is handling legal matters for the governor's office for the stay-at-home order to defend it. We do have the legal right to issue those executive orders, especially here in the context of a disaster declaration. And as you know, that's something that enables the governor of the state to take actions to protect the health and safety of people across the state, and that's what I've been doing.
Tia Ewing from Fox 32 has a question regarding Willie Wilson getting 100 pastors to go against your stay-at-home order. Have you reached out to Willie Wilson? What will you do if those pastors have service on Sunday?
Well, no, it's a ridiculous call on the part of Willie Wilson. The idea of encouraging pastors to bring what amounts to a large population of elderly African Americans to church to get together, not only in defiance of the executive order, but also putting them at significant risk. Think about it. We're talking about senior citizens who, as we know, are a vulnerable population. And add on top of that, African American senior citizens, most of those that he's talking about, and they are especially vulnerable as well. Those double sets of comorbidities, putting those groups of people together in large groups is an enormous mistake. And I would suggest that Willie Wilson do his homework, that he look at what the science and data says, that will do to people that obviously I care deeply about, and I assume he does too.
Two questions for Dr. Ezike, one from Phil Rogers, NBC5, who says, we are trying to compute data, and there seems to be a problem with the website. In your historical data for number of tests performed, it's the same number every day for every county for the last 10 days, only the number of positives change. Why hasn't that data been updated? Or is there another place where we can get the proper numbers? We're trying to compute positivity rates, but can't do that if the data is not complete.
Yeah, thank you for bringing that to our attention. I can make sure that the data team and the IT team looks into that and make sure that those are updated for you. Thank you so much.
Mark Maxwell, WCIA, says, in April, Dr. Ezike, you said that even cases, quote, with a clear alternate cause of death who tested positive are listed as a COVID death. Yesterday, you indicated that IDPH is trying to remove those obvious cases. When did that process begin? And can you explain the process? If it's not a forensic pathologist performing an autopsy, then who is doing that work to determine the actual cause of death?
So we are calculating, obviously, the numbers. We get reported deaths to us. And so, again, I think I've expressed this many times before, that because we are getting the information and turning it over the same day that we're getting it, it doesn't give us enough time to go through and make sure that there aren't some that are either the wrong state, need to be attributed somewhere else, that it's not a different cause of death, to make sure that there wasn't a double count, that there weren't the same people listed in two different reports. So again, not being able to have enough time in an effort to get the information out to the public so quickly, some of that review cannot happen. And so when it happens on the back end, then we do try to remove things that are clearly not intended to be listed amongst the COVID deaths. And so we are trying to remove, there was an accident, a car accident, if there was a homicide or a suicide or something that was clearly not COVID related, we are trying to remove those numbers to make sure that these are accurate.
I just wanted to wrap this up with a question that I had for the doctor regarding, I think last Friday I asked you if you had a snapshot of the possible cases of the child inflammatory syndrome that we're seeing across the country. I think New York is now reporting more than 100 possible cases related to that. And I think you indicated a few days ago that public health departments were going to begin reporting. Do you have an update today on that whole issue?
Yeah, please know that we have a very systematic process to approach this. So I have talked to many pediatric specialists, both pediatric infectious disease doctors, pediatric cardiologists, pediatric intensivists. And so we have assembled a team along with our IDPH staff who are going to convene. Again, from the information that I've received from all of these specialists, this is a complicated disorder. It's not a single disease, rather it's a spectrum of disorders, much like you would think of autism, where one autistic patient, you have the diagnosis of autism, but one patient can look completely different from another patient holding that same diagnosis. So again, with this inflammatory disease that's associated sometimes with shock, it's a spectrum of disorders. And so, in some cases you'll have the individual have coronary artery involvement, sometimes they don't. Again, that's why there is a team of specialists that are convening so that they can come up with some agreed upon criteria that will be used, that IDPH will then put out the guidance saying, this is the criteria, these are the features that we're looking for, this is what we want you, when you see it, to report to IDPH. So, again, sometimes information gets ahead of itself without getting the due process and the due diligence. This is not a situation of COVID with Kawasaki that has been reported repeatedly in the press. Many of these cases would not fit the criteria for Kawasaki. We have multiple Kawasaki specialists here in Illinois. They will be part of the team, but we want to get a clear definition of the features that will be looked for, and then we will put that out as what to let all providers know that these are the features that we're looking for, and this is what we're asking to be reported. So we hope to have that whole process completed before the end of next week.
I mean, should parents be concerned? What's your message to parents?
No, obviously just as we're saying, like kids who need to see their pediatricians for their well child check so that we can follow up on development, follow up on their growth, get up to date with vaccinations. We also, if you see any symptoms that are concerning, absolutely, we do want people to seek care. You can call your provider. We think that most pediatricians, most providers have in this time since the beginning of the identification of coronavirus have taken the appropriate steps to make sure that their offices are safe, that they're limiting the number of patients that come in at a certain time, that their staff is masked, that they're prepared to have, masking for their patients. So I think we definitely don't want to put off needed care. We don't want to put off important preventative care, and that's for adults as well. So people should seek care if there's any concerns about their children. I know people can start off, pediatricians, we're always on call. We take calls all through the night as well, but definitely reach out to your pediatric providers and get the care you need. We don't want to miss additional cases. And please know that even when this guidance finally comes out from IDPH, providers will be asked to look in arrears and look to see if there were cases that fit this definition, if there are cases that fit the features that are eventually delineated, and they will go back and still report those. So we're not going to lose cases that may have occurred. I think I've heard of 3 for sure that I know of, but perhaps there's more. I've talked to many providers at different institutions throughout the state to try to get a handle. I don't know that we've had as many as New York, but when we put the official guidance out and release that to our providers, we'll be able to see what it brings forth.
Okay, Eric, thank you. We're going to move to questions from our other reporters. This is from Kelly at Block Club. In factories with a cluster of COVID positive cases among employees, at what point is the state stepping in to ensure the safety of essential workers? What enforcement measures are being taken to make sure private companies are following proper safety measures?
Yeah, there are 2 ways that those get enforced, if that's the question. One is through the 3 ways, really. The Department of Labor, of course, complaints that are filed with the Department of Labor, complaints that are filed with the Attorney General's office, and as well private actions that people can take because of the negligence of the employer.
This is from Greg Hines, who's supposed to be our pool reporter today, but we couldn't get him to work, so we're going to ask his question. The number of positive test results have been soaring in Illinois in the past 2 weeks, sometimes leading the entire nation. Some of that is due to more cases, but to what extent is the increase telling us something about how far COVID has spread in the state? Dr. Zike, he'd like you to answer that one.
Thank you for that question, Greg. No, the issue is we have more testing. I think we've always known that if we saw a day in the early days when we had very limited capacity and could do maybe 100 or 200, that if you did those many tests, you would get a certain number of positives. But we knew that for that one positive, that wasn't the only positive in the state. For every positive, we know that there were many other people who did not get tested, who had similar symptoms. But, in fact, we were telling people to stand down because we didn't have the capacity. We said, okay, if you're a pretty healthy person and you have mild symptoms, but you were in contact with someone who was diagnosed, yep, you probably have COVID. So just isolate yourself. At that time, I think we were saying stand down for 14 days from the start of symptoms and then get better and then return. So we know that for every one, there were like many additional people for each one case that were positive. with us being able to test more, we're just getting to those actual numbers. But again, we know that there have been people who were sick and couldn't get tested. And we know other people who were around a confirmed case who probably were COVID positive also. So I think we should be looking at the denominator and seeing that it's a great thing that we're increasing our capacity for testing. As you look at the percent positivity, it's not that our percent positivity is going up. That's not the case at all. So the concern that, oh my goodness, maybe things are getting worse in terms of the higher numbers of cases, the higher numbers of cases are because we're testing more people. But overall, I think our positivity rate is not going up, but we do all want to know what our status is. And please, can I please emphasize that having one negative test or even one positive test, that is not your status indefinitely, right? People do recover from the disease. So once you're positive, that doesn't mean you're forever positive in terms of, eventually that test, if it was to be repeated, would go back to being negative. And conversely, people who are negative today, that's not a free pass, meaning that you could never get COVID. It means you're negative as of today. But if you are exposed and go on to develop symptoms, you then could have COVID as soon as a day or two later. So again, just to be clear on what that test means.
Thank you. This is from Jamie Monks at the Chicago Tribune. With the legislature reconvening next week, when will you return to Springfield, Governor, and how will the state pay for the aid package you're calling for?
Well, I'm glad that the legislature is going to return to Springfield, and I certainly look forward to seeing people in Springfield as a result of their return. Let me also say that very important to me that we pass a COVID relief package for the families of the state, for the small towns of Illinois, and for the small business. Much of the work that was done at the federal level missed out on supporting many people. There are just lots of people who fell through the cracks of that big federal program. The PPP program, for example, many small businesses never were able to access. We want to make sure that our small businesses, our family businesses out there, the small, the startups that people have put their lives into, we want to make sure that they survive and thrive. And so a COVID relief package, very important to do. How will we pay for it? Well, obviously, as I've said for some time now, we have real challenges with the loss of revenue because of COVID-19. So we need to rely upon the federal government and its support for all the states in order for us to provide the services that people need, in order for us to pay for the education that our kids need, and for us to support our businesses and our families in the wake of this, or as we're dealing with this COVID-19 crisis.
Yvette at Bond Buyer. Governor, while the state's $800 million long-term bond issue cleared the market today, it did so at record yield penalties for the state. Do you think it's worth it to pay such a steep penalty instead of holding off until you learn whether the federal government will come through with aid? Also, is the state considering using the Federal Reserve short-term lending program for either the $1.2 billion of certificates that have not yet sold or to issue other debt? And if not, why, if it lowers the cost of borrowing?
That's a lot of questions. Let me start with the fact that, there were people who didn't think any state could get a bond deal through. We did, and people, you see the strength of the folks who were interested in investing in our bonds. They see that the state has strength, that we've been on a path that was putting us on firm fiscal footing before COVID-19 came along. So I think they know that we're also going to be headed, as we're coming out of COVID-19 in a responsible way to deal with the financial challenges that we have. So that's why we were able to get strong interest in our bonds. The financial penalty that you pay in this environment, where every state is challenged, every state essentially has gotten a kind of a push toward the negative by those who rate the bonds of states. Of course, everybody's going to get a ding on the markets as they go out to seek to borrow. But it was important for us to do so. It helps us to continue to keep people working by investing in our capital program, and by lowering the overall pension liability, because portion of those dollars actually go to buy out folks who are in our pension system and retiring, and we can buy them out at a discount for the dollars that we're borrowing. So, we'll be continually accessing the public markets as states always do, but we were very pleased by the strong interest in the bonds that Illinois sold today.
Tina at the Sun-Times. The Sun-Times has reported that Navy Pier has received nearly $2.5 million in coronavirus stimulus loans from the federal government towards salaries and other expenses. Do you think the federal government should be loaning the Pier money to cover such high salaries?
Well, I mean, I haven't evaluated the application that the Pier put in, but look, we have very important functions of the city, of the county, of the state, these facilities, institutions that need to be supported, Navy Pier, the McCormick Place, others. It's very important, I think, that they are supported in one fashion or another. As to what the application said, I can't speak to the specifics of it. But as an institution, I think it's important for us to preserve those parts of Chicago that will be very important for us to come out of the crisis that we're in now and to come out of the financial doldrums that we're in now. People will want to go back to Navy Pier, and we need to make sure that the pier is strong.
Molly Parker at the Southern Illinoisan. When does the state anticipate offering guidance to state universities about when it might be feasible for the fall semester? Is it realistic for them to plan for on-campus learning? And what do you anticipate might be feasible for college athletes, which are a big recruitment tool?
First of all, our Board of Higher Education and our community college boards both will be considering whether or not and when the universities and community colleges will be opening. So I'm not going to render an opinion about whether they will or won't, but it's important to me that we get kids back to school, and I'm determined to see that happens. Having said that, again, we're all kind of watching the numbers and watching the progress here that we're able to make against COVID-19. What was the last part of the question?
Student athletes.
Yeah, I mean, I think all of us want to be able to give guidance this far in advance, but it's very hard to do right now.
Jim Leach at WMAY. With lawmakers coming back to Springfield, can you offer some guidance on where you think the budget should be cut or areas that should be spared cuts?
Yeah. Well, we're going to have to work on this together, the legislature, Democrats and Republicans, if they're willing to work with us. It's important that we have a plan here for balancing the budget. We have challenges that really require the federal government to be involved in terms of areas that I think are vital for us going forward. You know how important it has been to me to lift up, to improve our Department of Children and Family Services. To see that cut in any significant way would be really damaging, frankly. I think that's one area where that I can identify that I really don't want to see us do any damage to the progress that we've already made and keep us moving in a forward direction. There are other things, we talk about something important that nobody paid attention to before, the Department of Public Health. We need to invest in our public health infrastructure, and now more than ever, but we'll need it now in this COVID-19 crisis. But you know what? I think everybody realizes there could be another pandemic that comes along, another healthcare crisis, public health crisis. And so we need to invest in the fundamentals of our public health system, including our county public health system. So there's a lot that I think we're going to have to work on in this budget, but vital to this is getting support from the federal government. There's no chance that we won't have to suffer severe damaging cuts to higher education, to K-12 education, to basic services that people need. If we don't get any support, that's what's going to happen to our state. We're going to see just an enormous hole where we've made so much progress.
Brian Burrow at WGN Radio. A pork processor in Kane County has reopened with new PPE and new social distancing policies, but a processing plant in Rantoul is partially closed due to an outbreak. How many meat processors are still offline in the state, and are you confident when workers return to the facilities and new policies are in place that they're safe?
I can't speak to the number. I'd like to call on Dr. Ezike to talk about how we're dealing with those meat processors. But suffice to say that, we've jumped on top of each of those situations to make sure that there's significant testing and significant PPE to deal with those situations. So.
Yes, and we have been involved in many of these situations, along with the local health departments, along with the CDC, along with NIOSH, which deals with occupational and safety hazards. And so we are usually very able to give good guidance in terms of if a place closed, in terms of the industrial and environmental cleaning. Many times we are helping to orchestrate the mass testing of staff or identifying the staff that needs to be tested. We also want to make sure that staff knows, just in general for workplace safety, we want staff to know that they have rights and that they have to practice social distancing. And we want people to be able to speak up if they think in these different work settings that we aren't, that the appropriate social distancing is not being performed. So I think we have been involved in many of these, along with the local health department. We brought in the federal assistance. We actually have on-site federal assistance that we're expecting to come in to help with some of these ongoing challenges. So again, it's been a multi-level, all levels of government involved, all hands on deck approach to these situations. And we're hoping that as we go forth, we will just be able to be more seamless in how we roll out the protocols, and that other companies in the same situation will be able to take not only the preventive strategies to try to prevent it, but when cases are identified, we'll be able to move quickly to keep people as safe as possible and to do the required steps to make sure that operations can continue and that workers are kept safe.
John O'Connor at the AP. As you've noted, community health centers are doing COVID testing and have boosted testing numbers. On Tuesday, you mentioned stability payments for hospitals. Wasn't there similar aid promised for the FQHCs? Has that been distributed, and how much will it be?
I can't speak to the amount that's being distributed. I know there is support for local health centers. And as you know, in order for us to make some of the distributions of the CARES Act money, we're going to need the legislature to help us pass a law.
And John, I'm happy to get you that information as soon as this is over. This is from Ryan at WGLT in Bloomington. There's a lot of concern about the drive-through testing site, which is closing tomorrow. You said it was only averaging 26 people per day and that there are plenty of other testing options in Bloomington. We think you may have been given bad information. Is your administration willing to revisit the decision to open alternative sites here in Bloomington?
Yeah, what's important to us is that people get tested. And there were many, many days of the drive-through testing in Bloomington in which it was underperforming. I was citing one day. I have to admit that there are different numbers run through my head. I remember that being one of the days of Bloomington. The fact is, though, that what we want to make sure that happens is that people actually use the drive-through testing. The other drive-through facilities have done much, much more. Many more tests have been performed at the other ones. So we want to promote and encourage people to get tested. We reached out, spoke with some of the leaders in Bloomington, and were assured that they would encourage people to use the drive-through testing in Bloomington. And so we've extended the drive-through in Bloomington through next week.
Jake Griffin at the Daily Herald. A number of reports from researchers in China and India have shown the spread of COVID-19 through air conditioning at restaurants and offices. What is the state doing, and what can it do to ensure similar infections don't occur here?
Yeah, that's not testing that's been confirmed. That's not something that's been acted upon as a result, but we're very much interested in the CDC's determination and the studies that will be done to confirm that or to determine that that's inaccurate. But that's something that we're going to keep an eye on. Obviously, all of these situations, we don't know enough about this coronavirus, this novel coronavirus. So each time there's a new piece of information. You heard that the original call around this Kawasaki-like effect on children, was deemed to be somewhat inaccurate. Now there's a much more robust view of, what it really is and how to track it. And the same thing is true here. As we learn more, we're going to follow the guidance that's given, but the research capability doesn't exist for the state of Illinois, but does at the federal level and with private research institutions and public research institutions that have the ability to do so.
Okay, Hannah from the Daily Line will be our last question today. Governor, both the Illinois Thoroughbred and Harness Racing Associations are worried that their seasons will be severely truncated, spelling the death now for an already struggling industry in Illinois. Arlington Racecourse hasn't yet committed to doing spectator-free racing, but harness racing has. I understand it has also come to an agreement with the Department of Agriculture and IDPH on conducting races without fans in the stands. When will both of these types of racing be able to commence so the trainers will be able to earn their living?
When it's determined that there are rules that will keep everybody safe. That's the most important thing. I mean, obviously, in our Restore Illinois plan, we didn't list every single industry, including harness racing or horse racing, but we are making sure that each industry has a set of guidelines, and we've encouraged industry leaders. In fact, that's much of what's happening and been happening over the last number of weeks and weeks going forward, what the proper rules should be in each industry. How far apart do people need to be? Can they safely distance on the backstretch, for example? And, when they're lined up in a race, how far apart do they really need to be? Do they need to be in stalls that are, 2 apart, for example? So because you have jockeys, of course, and not to mention the trainers or the people who are working with jockeys at the start of a race. So all those things need to be considered. Obviously, as we've talked about with other major league sports, there will not be, at least at the beginning, fans in the stands. But it is possible, I think, to see that, at least I can imagine that there will be some approval at some point for all of horse racing. But again, I'm going to leave that to the experts, particularly the doctors, to make sure that everybody can do it safely.
Okay, that'll conclude our press conference for today. We'll see everyone tomorrow. Thank you so much.